Okay, so the drug I'll be doing today is enoxaparin. The classification for this medication is an anticoagulant. The onset is unknown. The peak is 3 to 5 hours. The duration is 12 hours. Any adverse effects is fever, nausea, edema, and hemorrhage. The adult dosage range is 1 milligram per kilogram every 12 hours or 1.5 milligrams per kilogram per day. Any nursing implications would be to monitor blood studies, assess patient gums, and decrease blood pressure, a black tarry stool, or anaphylaxis. Okay, after completing my drug knowledge, I will now be reviewing 2 medication policies. So one that I'm doing is 5.8, which says, so it's right here, so about 5.8, so for orders where 2 or more routes of administration have been ordered, indicate the route of administration used beside time given. And 5.10, for IM or subcutaneous orders where the site of injection is not ordered, the site of injection must be clearly indicated. Okay, so after completing my medication policies, I'm not going to put it to the side. Okay, and now I will be reviewing my patient's profile. I'll be reviewing my patient's profile to see the status that they're in, their vital signs, their pain scale, and their lab values. An example of this could be reviewing their CBC results. Okay, so after completing my patient profile, I will now be immediately signing the signature sheet. Okay, so after signing my signature sheet here, I'm going to put to the side. Okay, so now I'll be grabbing my doctor's orders and my MAR. I'm going to be completing my doctor order to MAR check. So it says that my patient here is Sid Garland. It says here, Sid Garland, that his medical number is 344316. It says here, 344316. His date of birth is November 8th, 1965. It says here, November 8th, 1965. My patient, his allergies are codeine and penicillin. It says here, codeine and penicillin. The drug or the medication that he'll be on is enoxaparin. It says here, enoxaparin. The dosage is 1 milligram per kilogram. It says here, 1 milligram per kilogram. The route is subcutaneous. It says here, subcutaneous. The frequency is every 12 hours. It says here, every 12 hours. The time a patient will be taking this is at 9 o'clock this morning. And any special direction says that my patient will be weighed weekly on Mondays. Okay, so after completing that check, I will now be completing some of my critical thinking. I'll be completing a pre-assessment. I would make sure that my patient doesn't have any contradictions to the medication that I'll be administrating to them today. So I'm going to verbalize hand hygiene, and I'm going to grab a medication, and I'm going to read the expiry date, which is December 2020. Okay, and with my medication in hand and my MAR right here, I'm going to complete my first MAR check. So my patient is Sid Garland. It says here, Sid Garland. The drug my patient will be taking is enoxaparin. It says here, enoxaparin. The dosage is 1 milligram per kilogram. It says here, 100 milligrams per milliliter. I'll be completing a calculation, so this will be different. The route is subcutaneous. It says, I know this is subcutaneous, so this is an injection. The site will be the abdomen. The frequency is every 12 hours. The time my patient will be taking this at is 9 o'clock this morning. And the reason behind this is that my patient is suffering through deep vein thrombosis. Okay, so now I'm going to complete my second MAR check. So my patient Sid Garland, I know is here, it says Sid Garland. The drug is enoxaparin. It says here, enoxaparin. The dose is 1 milligram per kilogram. It says here, 100 milligrams per milliliter. I'm going to be completing calculation, so this will be different. The route is subcutaneous. I know this is subcutaneous, so this is an injection. The site is going to be the abdomen. The frequency is every 12 hours. The time my patient will be taking this medication at is 9 o'clock this morning. And the reason behind this is that my patient is suffering from deep vein thrombosis. Okay, so after completing that, I'm now going to be completing my first calculation. Okay, so I'll be reading my calculation. So the calculation that I was given was that, well, not the calculation I was given, sorry, the weight that I was given was 65 kilograms. So I will be doing, so I want to convert my kilograms to milligrams. So I'll be doing 65 kilograms times 1 milligram equals 65 milligrams. Okay, and now I will completing, so 65 milligrams divided by 100 milligrams times 1 milliliter. So I got my 100 milligrams from the vial, how it says there is inside the vial 100 milligrams. So I'll do 65 divided by 100 times 1. So my answer is 0.65 milliliters.